I'm Bethany Russell, Director of the Mission Gait Academy. In this series, we'll highlight innovative technologies that can enhance skilled physical therapy. While we aren't affiliated with the companies featured, our aim is to inform, inspire, and open the door to new possibilities in rehabilitation. Well, welcome Stephanie, welcome Sarah. Thank you so much for joining us today. Can you share a little more about your titles and about OneStep and what it is you all do?
Hi, everyone. My name is Stephanie Wakeman. I am a Director of Clinical Affairs here at OneStep, and I am a physical therapist by background. So I have a couple decades of clinical experience, and I have been in the digital health space since about 2019.
And hello, everyone. My name is Sarah Anestam. I am also a physical therapist by background. I've been in practicing clinician for about almost 25 years. The past 2 years, I've been in the technology space. I'm a partnership executive here at OneStep, and I'm really, really happy to be here today.
Well, great. Yeah, we're glad to have you. So can you give an overview of the OneStep app and what it is you all do in case anybody's not familiar?
So an overview of OneStep. So OneStep is a digital health platform that turns a smartphone into a clinical tool, basically. So when you download an app onto any smartphone, whether that be iOS or Android, it turns that phone into a clinical mobile analysis program. So you can put the phone in your pocket and take a very short walk, just like a 30-second walk or so, and we can extract a full clinically validated gait analysis from that walk. And the app is also able to detect or to measure specific standard tests that physical therapists do, such as a timed up and go and sit to stand test. And all that is done just from using the tools that are inherent in the smartphone, the accelerometer and the gyroscope, to measure the mobility and provide some objective values to those movements.
Can you share a little more about the inspiration behind this app and has it evolved since you all started? I'm curious to kind of hear a little more about the journey.
It's evolved a lot since we started. Yeah, so OneStep was born in 2018, and there are three co-founders, and they all met in the Israeli Defense Force when they served their time there. And they were studying this technology for intelligence uses at the time, and when they were completed with their required, their requirements there, they decided that they wanted to utilize that knowledge to do something good. The initial phase of OneStep was to see if they could use this technology to detect if someone is having a stroke. And they noticed that, when an individual is starting to have like an active stroke, then their whole mobility patterns change. And they really wanted to try to use it as a predictive model for that. And although they didn't get to that phase yet, they understood from that exploration that the smartphone and the intelligence that they have gathered around that whole discovery process can be used for gait analysis and for detecting all kinds of movement patterns, and not specific to stroke, but all kinds of neurodegenerative patterns and other mobility issues as well. So it was born out of that. It evolved from using this as a remote patient monitoring into falls prevention and improving our analysis as we've gathered more and more data, adding more and more standard tests and measures. So we are able to track and follow the trends of people over time and go as far as looking at specific diagnostics or specific recovery trajectories from either a surgery or some type of acute condition, and understanding what a typical recovery may look like, so we can quickly identify an individual who is not following that recovery and intervene before there's some type of adverse medical event. So there's been a lot of evolution with OneStep over time, and a lot of incredible analysis and validation of the technology as we've collected more and more data and worked with different patient populations.
What a story. That's so cool. I'm curious to hear about how you all differ from just the native phone apps and how you differ from maybe other apps.
Well, I think the biggest difference, Bethany, is we are focused on kind of that unhealthy population, unhealthy gait, right? You look at a lot of the Apple Health Kit. I have a watch on myself, and it's great at picking up some general parameters. How far do you walk? But there's a point where normal becomes not so normal, and that's where we pick up that difference. We are clinically validated. We have about 7 different validation studies against gold standard gait labs. And really, we're able to do this within 20 to 30 seconds with immediate real-time feedback. So, when you talk about gait labs that are used, number one, very expensive, large labs, those can run into millions of dollars. And it's not accessible. So we bring that Gait lab to anyone, really, because it runs as an application on a smartphone. It can be used in any setting. And so we're seeing the ability to have that Gait lab in an inpatient setting, outpatient setting, home care, even remotely to monitor residents or patients when they're no longer under maybe a plan of care. We can use that, bringing that fully validated Gait lab. And again, all you need is the phone in the pocket.
Yeah, very neat. I can definitely see where that would have really wide applications. So I'd love to hear if you have an example to share of a specific patient, if you can, or a specific time when your app was used to help a patient in the clinic.
We have so many of those. And, just to pick a few of them, I think a couple of them stand out to me. Just recently, I was speaking with a partner of ours who works in prosthetics and has been working with a gentleman who was a bilateral hip dysarticulation and was really having difficulty getting the appropriate device approved by insurance. Had been denied several times for microprocessor knees, and I think even more components. So he was really interested in using OneStep to gather objective data about the differences in this person's gait and fall risk with one device versus another. I just spoke to him yesterday. He said we actually, in using OneStep's data to supplement the information sent to the insurance company, they finally were approved for the most appropriate device. So this gentleman who obviously has a lot of impairments now has a device that is going to be the most appropriate in helping decrease fall risk and really promote independence.
That's wonderful. Yeah, because I've seen multiple studies about how correct componentry has a direct relation to reducing fall risk. So I know that can be really powerful.
We're talking about prosthetic, but probably more common with our senior living partners. We hear stories, and one in particular was a gentleman with ataxia who was using a bulky cardiac walker. It's very big, and was really nervous about using any other type of assisted device. So our partners there used the OneStep, phone in the pocket, had this gentleman take a walk, and was able to look at walking with that cardiac walker versus a standard rollator, which at first this patient was very apprehensive. But that patient was able to see that his walk improved significantly with the rollator. The fall risk had decreased. And so now we're able to justify, okay, this is a much less bulky device, allowing for greater independence. And his confidence went up quite a bit because he saw objectively, with his own eyes that yes, all of the different parameters that we collect improved with this different device.
We actually used it with a patient with her rollator compared to her trekking poles. And the patient recently had her left knee replaced, but has had a pretty complicated recovery process. And so she was feeling a little discouraged, maybe regretting the surgery a little bit. She's sort of in between a rollator and trekking poles. And so we did OneStep in her pocket for both. And an interesting thing is we found that her right step length is longer than her left, and her stance time is longer on her left. So even though she's not feeling great about that surgery, her body is already relying on that corrected knee appropriately, and her other knee has arthritis that has not been corrected. So the app did kind of show that she is taking advantage of this surgery and getting some good results from it. And then also her clinician had recommended that she actually go up from trekking poles to a rollator because she was having low confidence. And we saw all these differences in her gait pattern. So we were able to show her objectively. And it was just really cool because it matched her perception. Like she said, she does like her rollator. She feels more confident with it than her trekking poles. And we showed her how her gait speed was higher with the rollator. Her symmetry was better. The app identified her as a lower fall risk when she had her rollator. I think it's nice sometimes even to just affirm to patients like the data completely backs up your experience. Like we already believed you. This is why we listen to people when they tell us what's going on. So it shows us trekking poles are for exercise. The rollator is for the community. So yeah, it was a really a really neat experience. We really enjoyed it.
And we see that a lot with, we're bridging the gap between the subjective reports. And as therapists, often what we base our clinical judgment on is subjective reports. And we're trying to use more and more objective. So this bridges that subjective to objective gap, and is really, really powerful.
Yeah, I agree. It is a lot nicer to have in terms, especially again, dealing with insurers and that, they just need data. They have to do their job. So it is really nice to be able to get hard data that's, we can be a little more objective with.
And this is not the first story that I've heard with that has helped the patient make a decision for themselves. Oftentimes patients don't want to hear other people tell them what to do, or they don't agree with what the therapist is, or doctor or family member is saying. And we had an incident or a patient that was just like that, who he had a fall history because he wasn't using a walker. He was told to use it by everybody. He owned one, he didn't want to use it. He was the couch surfer type of person. And it wasn't until he saw what his data, what his walk looked like from the OneStep data without his walker, because he perceived he was just fine and he was safe and he didn't need anything, until we showed him that objective data that no, you're not fine. And here's why. And then he started using his walker again. So his gait didn't necessarily improve, but he became safer and had fewer falls because he actually started using the walker he was told to use, and only because he actually saw the objective data that backed up what everybody else was telling him. So a little bit opposite of the experience that you had with your patient, but it can go both ways, right? Where it's a patient, it's informing the patient about their progress, either affirming or confirming that they need to do something that they maybe don't want, and that therefore they become more compliant. So it's really great for all of those reasons.
Yeah, I love that. And either way, just making a more informed decision is always, I always am going to feel more confident. I'm sure patients do too when they just have more information behind their decision either way. So I would also love to hear some more about the research behind your app. You mentioned you do have several validation studies. Do you all also have like fall reduction studies? I think I saw something about that somewhere. Yeah, just curious to hear more about the research.
So we have a lot of research, as you mentioned, that was completed by third-party institutions. A lot of the separate universities have done research comparing us to the gold standard of camera and sensors, and we've come in to be just as reliable and sensitive and specific as the gold standard measure is. With regards to the fall measure, the fall risk measure, it's been a little bit harder to gather that information because we're reliant on some of our partners to give us their fall data. But we did have one partner who did share falls data with us. When they compared the use of OneStep in one quarter to non-use of OneStep in the previous quarter, that they saw that there was indeed a reduction of falls in that quarter that they used OneStep. And then we also had a separate partner that looked at their patient population that had a history of falls and what OneStep identified them as. So all of the patients that OneStep identified as a very high fall risk, those people did have a history of falls, and they were considered, a high fall risk by their providers. So we're seeing more and more correlations and comparisons to the data that we're getting from our partners, but right now it's not robust enough to write a full longitudinal study on that information. I don't know if you've heard anything outside or anything in addition to that, Sarah?
No, it's just that we're relying on our partners to provide that fall data before the implementation of OneStep. And what I'm hearing though is there are more and more people that are very interested in that. And so we will see a lot more case studies, longitudinal studies, because that is really what people are looking at now. How can we cut? We know the cost of falls is extremely high, and what technology can we use? And we want to prove the efficacy of that. So stay tuned, I should say.
Yeah, that's great. That's very exciting. So I'd love to circle back to a term. I think you used, Sarah, remote therapeutic monitoring. I understand you all have sort of your whole paradigm behind this, and I'm not as familiar with the term, so I'd love to hear your paradigm on remote therapeutic monitoring and kind of where you see it living in the future of rehabilitation?
Yeah, absolutely. So again, RTM or remote therapeutic monitoring is relatively new. CMS approved these CPT codes 2022. So there are some therapists, PTOT speech, even primary care physicians that are billing for RTM codes. But in theory, what it is it's the ability to monitor a patient in terms of their mobility outside of in-person visits, right? And so we know that RPM, remote physiological monitoring, has been around for a little bit longer, and that's monitoring things like blood pressure remotely. So now we're able to do this in the therapeutic space. And so what we do, because we can monitor motion both actively and passively with the app, we have the ability, or our providers have the ability to see how someone is functioning in between sessions. And so just with the phone in a pocket and running in the background, as long as a patient enables those background permissions, we can get insights or provide insights to clinicians about fall risk, the parameters of gait when they're just walking around in their natural environments, right? And so we often know when someone is in therapy sessions, they're going to act a little bit different than what they do in real life. And so this is giving insight into what is actually happening, this meaningful data that a therapist can then review and help then change treatment plans if that's warranted. And even beyond that, if you can imagine someone who has been in a plan of care and they're at the end and they've been discharged, the ability to have this insight to still give to a therapy team to see if there's some changes that may indicate that this patient needs to come back for therapy. And really rethinking as therapists and healthcare providers how we monitor someone. It's been in the past so episodic. And so, just from one session to another. But they're in clinic with us, 3 hours a week, 5 hours a week at most. So really taking that view that medicine in general has done, being able to monitor heart rate, blood pressure. So treating gait as that vital sign and really looking at that over the lifespan and over different venues of care and, whether they're at home or they're in an assisted living facility or in a hospital or outpatient setting. We're measuring that constant gait, right? And so treating it the way that other vital signs have been treated for so long.
Yeah, and I think that makes total sense. And to me, it's very similar to blood pressure monitoring because I know many people whose blood pressure is high when they go into the clinic. And so instead of immediately getting put on blood pressure medicine, they'll monitor it at home to see if they just have white coat syndrome. And similarly, I've read the studies that say that gait speed is both underestimated and overestimated in the clinic. It's not like we have an offset that we can assume, it's just kind of all over the place in the clinic because people walk differently in the clinic. So to me, it sounds exactly the same. Of course, you would monitor someone's blood pressure when they're at home and relax. And of course, I would want to know their gait speed when they're at home and not being observed.
I do like to separate the remote monitoring, which is what Sarah just spoke about, which is monitoring somebody between visits in the clinic, and the practice and billing of RTM, of remote therapeutic monitoring. And so just to talk for a moment about that, is the practice and billing of RTM provides us with additional CPT codes, us as therapists, PTs, OT speech, with additional codes in order to bill the time that we spend treating or the time that we spend outside of the actual treatment session, looking at patient data, speaking to the patient, analyzing what's going on with this individual. So that gives therapists an opportunity to bill for that time that they're already doing, that work that they're already doing, that they can actually start to bill for that time. And it also improves that patient care because now that you're getting billed for it, you are going to spend more time analyzing your patient data and understanding what's happening with that individual, connecting with the patient outside of clinic time, and getting reimbursed for doing all of those things. And that just enhances both the patient experience and also improves the patient outcomes as well. So it's a win-win for all.
That's really neat. Speaking of how therapists use this tool, I'm curious to hear either of your perspectives on how PTs can maximally use your app and use it well. So a pitfall I've seen with kind of any advanced technology is thinking that if I just have this technology and I put it on the patient and use it with the patient, there, it's excellent PT. You know what I mean? Instead of diving into maybe more of the nuance. So I'd love to hear from you all about the nuances of using this kind of technology really well.
Yeah, that's a great question. So it's one thing to get a whole bunch of really cool data, and another a totally separate issue is how to interpret that data and what to do with it. And we do find that to always be a little bit challenging. And so one of the good things about OneStep is that we are providing, we are looking at this data. We've become experts in what this data means, and we're providing interpretations and some recommendations to the clinicians about the data that they're getting from their patient. So we all understand gait on some basic level as physical therapists, but we really haven't learned in school, what does it really mean when their step lengths are shorter? What does it really mean if they're walking too slow consistently? And as we start to gather this data through all of these various types of patient populations, we're getting a much better understanding of what it actually does mean and what we can do about it. What are, the meaning of short steps could be varied. There's never any complete black and white, just like with anything in medicine, right? But we can understand that perhaps there is an issue with pain, or perhaps there is a problem with range of motion that their steps are shorter, or maybe they're just not confident with their walking, and so they're taking shorter shuffling steps. And so we provide this insight, and then we also provide some suggestions on now what to do about it. So we really try to look outside of the box and think beyond the standard cookie cutter, physical therapy exercises, and provide some functional movements to improve that functional pattern. As we all know, we can't train for a dynamic mobility pattern with a static exercise, right? So we really need to try to encourage people to open up their mind and become a bit creative and provide these suggestions and recommendations based on what we see in the data.
Yeah, that's great. That makes a lot of sense. Sarah, did you want to add anything?
Well, really more just from a workflow perspective. I mean, there's so many shiny toys out there, right? And so it's often enticing just to, oh, let's get that because that's the newest. But what we're doing is we're introducing something that is already fitting into what most therapists do anyway, right? And so we know that someone comes in for, let's say, their first visit. You're going to look at how they're walking, whether it's on a treadmill, whether it's just across the clinic floor. Same thing with your standardized test, like your timed up and go, your sit to stand. We know that therapists are doing this, and often non-clinical staff as well. And so we're just making it easier for them. We're collecting the data. We are then providing the insights, and we're allowing the therapist to just really spend that time maybe more hands-on with the patient. If there is a level of assistance that's needed, it's often hard to allow the therapist to support that patient and also observe how they're walking. So it really just helps with the workflows, and we're creating efficiencies. So yes, it is a shiny new tool, but it also has a purpose. And as Stephanie had mentioned, the data that we're collecting is really valuable in providing insights for certain patient populations.
Yeah, that makes a lot of sense. Thank you. The next question, we've sort of hit on this, so you let me know if you feel like you all have already answered it. But we have a question in here of how does your technology reinforce sort of core concepts in physical therapy? So, for example, when I was working with like gait rehabilitation equipment, like robotics, to me that reinforces the importance of repetition in gait training. So I'm curious if you all have a perspective about how your technology reinforces any core concepts.
One of the biggest core concepts that I would like to talk about is the idea of assessing the fall risk for an individual. And we are encouraging the use of, using test clusters to improve the specificity and sensitivity of any test. I mean, whether you're doing an orthopedic test for rotator cuff, you want to do several tests to ensure that, yes, this most likely is a rotator cuff impairment, right? You're not just going to do a simple, scaption and say, oh, it's a rotator cuff, right? You're going to add to that to ensure that you're much more accurate about your diagnosis. And so it's the same with gait and fall risk. And what we've done with our fall risk analysis is that we have combined the evidence-based tests into our fall risk assessment profile. So that does include a timed up and go, a 30-second sit to stand, assessing an individual's fall history and their confidence in falling, and of course, assessing their gait. And so those are the primary in the literature that you'll read about fall risk. Those are the primary assessments that are looked at and considered when it comes to deciding or looking at someone's fall risk profile, if they're going to be low, medium, high, or very high fall risk. And so we've taken all of those tests and we have combined that into an algorithm, a unique algorithm that is going to identify someone's fall risk profile. So it's a very unique way of looking at someone's risk profile. And to sort of piggyback on what Sarah mentioned earlier about, clinicians are already doing these things. I mean, these are the tests that they're doing, but we are looking at it in a much more nuanced fashion, providing that objective data about their gait speed, providing breakdowns of, say, the timed up and go. So not only can the therapist see how long it took them to do that test, but OneStep will provide the breakdown to see how long did it take them to stand, to get to the marker, to turn, to come back and to turn. And so understanding the timings for those turns also adds to the knowledge of that individual's dynamic performance and dynamic balance. And it's providing all of that information in tests that they're doing anyway, but giving much more robust, enhanced insights into those tests and assessments. So that's how we can continue to promote the therapists to work on what they've already know, but do it in a much more robust manner with greater insights.
Yeah, I love that. And I think that more robust testing also gives us more sensitivity to change, at least in my clinical experience, having also used test clusters with patients at risk for falls. And then it's kind of hard to predict like which measure a patient will improve in, even if you're kind of addressing all of the sub skills that these measures are testing. I just find some things might not improve. Sometimes dynamic balance might improve a lot, and then their gait speed is the exact same. And so if I had only measured their gait speed, what I would have to show for all of our hard work is no improvement. So yeah, I'm absolutely there with you on the importance, really like how crucial testing clusters are.
And that's a great point. I love that you brought that up, Bethany, because we see that often. There may not be a significant improvement in gait speed, but they were able to increase their step length, and they were able to decrease that turn time, and they were able to add 2 more repetitions to their sit to stand test. So all of those things are showing that there's been an improvement in some functional strength, an improvement in some functional mobility. So it's a really excellent point.
Sarah, anything you wanted to add to that?
I think just again, talking about clinician workflows, where I see this in addition to the fall risk and the clustering of tests, the ability to really prove the efficacy of your treatment. So imagine analyzing someone's gait or any of the other tests that we can measure, and then doing an intervention, whether it's a therapeutic exercise, a manual technique, dry needling, maybe changing an orthotic, taping a different way, and then being able to retest and really being able to see in real time during that treatment session that yes, those parameters improved. Now, whether it was from the dry needling or something else, you could use it very specifically to just do one intervention at a time and then retest. But at least it's giving some more justification to, yes, these techniques that we're doing in clinic or even with the exercises at home are really leading to an improvement in their gait parameters or dysfunction overall.
So my next question is has to do with artificial intelligence. I would love to hear from either of you, both of you, on your perspective on what you see as the role of artificial intelligence in rehab, both now and or in the future.
So, AI is here and it's been here for a while, right? And we're using it day to day and really every aspect. And it's really meant to enhance what the therapist is doing, right? And so we live in a world where there's staffing shortages, there's time constraints, there's burden on the clinician side, right? So being able to have something that is going to take some of that burden away with some of the tasks that they don't need to have as much of a level of skill, right? So from documentation, from being able to provide okay, this is based on the data that was collected. This is the documentation that you can put into your note. And so we have AI tools for documentation that really help with efficiencies. But when we're talking about just technology, not just from the clinician point of view, for the patient side, to help improve patient engagement, to again, to see what they're doing at home outside of the clinic. So there's so many tools that are out there. And we have specific AI tools that are probably more geared on the documentation side. But basically, what our system is doing, our developers are looking at all of this gait data. And we have, it's about 1 million gait cycles per day now that we're collecting. And so, on more on a population health level, imagine being able to say, okay, we know now what someone looks like 2 weeks post-operative from a total knee replacement, and to then look at your specific patient and see that they're not following that same trajectory, right? And so being able to identify trends earlier than we would be able to without these AI tools. And that's just one example of really how we are helping just enhance the healthcare system in general.
I'd agree with everything that Sarah just mentioned. AI is here and we need to embrace it and we need to use it to enable like a digitally enabled care, right? Which means that we're using this new technology to improve our insights so we can therefore provide very targeted interventions to specific impairments. And that is just critical to our profession and to really the whole medical community going forward, is understanding how we can utilize this technology to improve our interventions and to assess and analyze the outcomes of those interventions. And we've kind of talked about a lot of that already. But, in order for us to be successful in that, we really need to understand the importance of the application of it and the importance of integrating it into the existing workflows. And we've talked a little bit about workflows already today, but it's so critically important when when you're thinking about utilizing any type of AI-enabled tool that you have all of the relevant stakeholders involved in that process, including everybody from leadership to the clinicians who are going to be using it to the people at the front desk. Everybody needs to be involved and engaged and understand how this is going to help them. And choosing that technology that is already enhancing what the clinicians are doing and not adding an extra task. The last thing a clinician wants to hear is, oh, it's just one more thing. It'll just take one more second or whatever it may be. Nobody wants to hear that. Right. So we need to ensure that we have this digitally enabled care that is planned through leadership down through all of the stakeholders, and that it's been well researched, that it's a validated tool and that it can provide improved outcomes as well. So it's here to stay, and it's really how are we going to use it, and how are we going to measure it, and how are we going to implement it into our workflows. So it's really all very important things to consider.
Sounds like it can function both as sort of an assistant, especially with like the documentation stuff that you mentioned, kind of taking on some of those tasks to let the physical therapist stay closer to the top of their scope of practice and spend more time on the interesting parts. And then also as a tool to kind of maybe overcome some of like my limitations as a human with only 2 arms. And so if I have to guard someone, like you said, I can't closely watch their gait, or I can't see their step length, I can't see their symmetry, things like that. So that's sort of what I heard as those kind of two categories. Would that be an accurate summary?
I think so. Yeah.
Cool. Well, great. Well, was there anything else you all wanted to share about your app or about its use in physical therapy practice?
I'd just like to add, based on conversations that I have on a daily basis with healthcare providers, this is something that it is really overdue in my mind. I think Gait, if we just get back to what this is at its heart, the Gait assessment is often overlooked, and I've been in the outpatient setting for many, many years. And, sometimes someone comes in and there may be an upper extremity patient or someone with cervical involvement. And we typically will look at gait, but how vital gait is to the entire rest of the person, right? And especially with fall risk. So being able to use this as that vital sign and really being able to look at this in a different light than what we have in the past. And as therapists, sometimes we're resistant to change. But really being able to have this data at the right time so we really know who to identify, who needs care, when do they need the care and what type of care do they need, and really being able to do that much more efficiently than we have in the past.
I'm glad you brought that up too, because I meant to discuss sort of the idea of the dental model of care. Like you all aren't the first ones I've heard talk about like maybe improving our overall model of care. There's talk about, and I think some data on the efficacy of the dental model of care for like persons with neurodegenerative diseases. Like if you have Parkinson's, perhaps you should just plan on seeing your physical therapist every 6 months, just like you would the dentist. And so I could see how this could also fit in really well with any of these people with complex diagnoses, complex gait disorders. It seems like it would perhaps improve the efficacy of, if we had a plan of like, yes, I will see you every 6 months and rerun your outcome measures, or when OneStep flags you, or when something starts changing, you start slowing down at your gait speed and we don't know why. It seems to me like that would be a perfect time to pull someone back into the clinic and get some more data, more information. Am I thinking of that correctly, would you say?
I think you're spot on. And I think that leads into the conversation of thinking about episodes of care a little bit differently. In the therapy world, we're used to having evaluation and seeing them for, I don't know, 6 weeks, 12 weeks, and then discharge. And then we don't see that person again until maybe they injure themselves again and suddenly they become a frequent flyer. Right? We're all familiar with that lingo. And so changing that frame of thought to, instead of all of these separate episodes of care, to maintaining someone as a customer that you're always checking up on. So similar to what you stated about the every 6 months coming in, but that person is always part of your caseload. Right. So they may not be in an active episode of care right now, but they're part of your caseload and you're checking in on them. And so OneStep has the RTM features, the remote monitoring features to allow for that. And as we continue to start to change our practice in that method, and we continue to collect some of this data on Gait and understand more about Gait and how it differs from gender, from age, and different types of diagnoses, we're going to learn so much more about the human body and mobility and be able to provide even better and more targeted interventions. OneStep, we base everything on evidence and we're always looking in the literature, but I can honestly say the literature on Gait is a bit limited, especially when it comes to how different is it between the sexes at a certain age? How different is it between, someone who has, early onset Parkinson's to a late onset Parkinson's? We don't have that data. And so OneStep, we're continuing to collect as much data as we can, continuing to perform the studies and provide this really in-depth insight so Gait can truly be used and seen as that sixth vital sign, and hopefully not just for therapists, right, but across the medical community, and they can understand the importance of it and utilize PTs as part of that continuum of care going forward.
Yeah, absolutely. And that's really exciting to me. And you mentioned, collecting 1 million steps a day. One of the downsides of PT research at large that I think we face is our low sample sizes in so many of our studies, and how almost all of our studies have to conclude that the generalizability of the study is limited because it's hard to get more than 32 patients in your RCT. So the concept of you all like building this database of millions and millions of data points, that makes me excited for the strength of the conclusions that you will have the potential to draw and the generalizability of those results. I think that could really be really helpful to the body of literature in PT. So I'm excited to see what you all publish. So where can people find you all if they're interested in learning more about OneStep?
They can go to onestep.co. That is our website. And from there, there's a wealth of information about the product and about what, depending on the use case, what the value our providers are seeing. So that's probably the best place to start.
Okay, thank you so much for your time. I really appreciate it.
Thank you, Bethany. This was a lot of fun. Thank you.
Yeah, this was fun. Okay, you guys have a great day.
Thanks. Bye-bye.
This video is part of a series on rehabilitation technology. We encourage you to view our other videos in this series and to share them as well. You can find them on our YouTube channel at youtube.com/missiongait. To stay up to date on our latest content, click the link in the corner to subscribe and be sure to like and share this video. If you enjoyed this content and found it helpful, please consider joining the mission or donating using the link below or using the donate button on our website, www.missiongate.org. We love providing this information for free to anyone using the YouTube platform, and it's all thanks to our generous donors and sponsors who truly see the value of this information. How about you?